All right, why did you choose this specialty? A very common question, and you need to have an answer for this. I'm going to give a sample answer for internal medicine and look further in this program for other specialties such as general surgery, psychiatry, family medicine, pediatrics, and neurology. Anyways, we start off, of course, with a bad answer, an answer that my followers, people who are with my program and watch my videos, they should not be getting this answer wrong. Okay, before we get to the sample answer, I wanted to mention something that may help you. If you are struggling with your residency interview preparation, listen to this, as it may make the valuable difference in helping you match. For those of you who really want to be successful in your interviews, I have something for you. I have this extensive program that will be great for any of you. And with the first option, you have all of my videos ready with template answers, sample answers for multiple specialties for you to copy and paste and use it as your own answer. Now, this was a video course program. Now you want to scale up? Then I have weekly group sessions conducted by myself, small groups, about 12 sessions for this season. And you can have your interview ready in no time. And this will include everything in the video program. And somebody who wants one-to-one sessions with myself, I have the 3 hours one-to-one session with myself, mock interviews, and this will of course include everything in the previous programs. All right, and what will you get? You will get common questions, answers, templates, frameworks. If you are in the group sessions, then you will talk to me directly. And you will have behavioral questions, you will have ethical questions, everything will be included. And all of this is right now going to be 50% off for a limited time, actually more than 50%. Go check it out with the link in the description. Thank you. I chose internal medicine because, it's broad and gives me a lot of options. I like helping people, and internal medicine seems like a good way to do that. I guess I'm still figuring out what I want to specialize in later down the line, but internal medicine covers a lot, so it definitely makes sense to me. Thanks for asking this question. So this was a bad answer, very vague, unfocused. It was clear that it was not planned out, and you did not have a streamlined thought process. That was a problem. And you did not have any examples. Okay, so that was again another problem, that what I always talk about, you need to have examples. And then there was sort of an uncertain commitment connected with this. You're still sort of figuring it out. Well, that's pretty much okay. It's not absolutely wrong to say that when you are just starting to go into internal medicine, but you have not really added anything to that line that I'm still figuring it out. You didn't have any direction moving forward. How will you figure it out, right? Going towards a good and a prepared answer. Well, thank you for asking this question. I chose internal medicine because I, of course, love the challenge and the complexity of diagnosing and treating adult patients with diverse conditions. And I do recall one specific experience. Of course, there were many. During my internal medicine internship, I encountered a patient with multiple chronic conditions coming in with DKA, diabetic ketoacidosis. And of course, the patient had numerous other problems, heart failure, asthma, COPD. He had CKD stage 4. So this guy was not the most simplest individual. However, this was very exciting, and you were looking at each diagnosis, each medical problem and history, and seeing what you need to do with regards to that particular situation. So it was rewarding to collaborate with a multidisciplinary team to manage his care. And we were adjusting medication, adjusting things almost on a daily basis, following labs. And of course, you know about the management of DKA. Initially, the first day or so could be different. The next couple of days will be a little different. And then patient is stabilized, and you then bring everything together and move the patient towards discharge. This was very rewarding. And I also played an active role in lifestyle modifications and interventions with this patient. Although this patient had already reached a stage where just lifestyle modifications will not be helpful, however, they of course do play a part. So the intellectual challenging parts and navigating multiple systems and understanding the full spectrum of disease and a patient definitely excites me. And then moreover, I am drawn to internal medicine because it focuses on the continuity of care. And I do personally myself feel that I do want to build long-term relationships with my patients and supporting them through their various stages of their health and illnesses. And again, during my internship, we did have outpatient clinics, and I remember following a person with high blood pressure, really uncontrolled, and over 2 to 3 visits we were able to control her blood pressure. And then further down the line, the blood pressure remained stable and the patient did not have any significant issues. So yeah, the experience, of course, also reinforced my desire to provide a holistic, patient-centered care that is going to be long-lasting and over time. And lastly, internal medicine offers a great foundation for a wide range of subspecialties that will, of course, allow me to remain versatile by continuing to explore areas such as cardiology, endocrinology. I'm still thinking about it, and I look to delve into my first year of residency and then decide by the end of that year and then focus on finding the specialty that I will be going for. So I appreciate that internal medicine does keep a lot of doors open for me at this current point, while still allowing me to work closely with my patients and make a tangible difference in their health. So why not internal medicine? Thanks for asking this question. Thank you. It was, personal. I gave some personal examples. You have to give examples. This is what you are learning throughout my program. Examples are the mainstay for ensuring that your answers are going to be well received. All right. Then passion and understanding. Because internal medicine, it's, you need to have passion about all the different aspects of internal medicine and understanding that what internal medicine actually requires. It requires a detailed look at all the different medical issues, and there is a strong emphasis on the continuity of care and collaboration among different specialties. And then commitment. Commitment is being shown. You're clearly defining why you like internal medicine and the 3 different aspects that I mentioned. So hopefully this helps. Look at my video on the framework and the do's and don'ts so you can home in this question and look at the sample answers, the templates for internal medicine and other specialties. Thank you.